Well, we may have others joining as we begin, but I'm going to go ahead and start. And I want to welcome Dr. Brazeau, and I want to thank her for meeting with us virtually. I'm really sorry we couldn't be at the pharmacy school. I understand the concerns of everyone, and I hope at a later date when things are more normal, if we ever get to a more normal, that I know that we will be welcome. That's to schedule a time with Dr. Brazeau to come and see the facility because it is an outstanding facility. I was overwhelmed, and not overwhelmed like I didn't think it would be nice, but it was so wonderful to see the pharmacy school. I loved every minute of our tour. So I want to welcome Dr. Brazeau, as I said, and I want to give you a little introduction. Dr. Brazeau received her BS and MS from the University of Toledo and her PhD from the University at Buffalo. She is currently the Dean at the Marshall University School of Pharmacy. She previously served as Dean at the University of New England College of Pharmacy. Previous faculty appointments include the University of Houston, the University of Florida, and University of Buffalo. She currently serves as the editor for the American Journal of Pharmaceutical Education. She has served as the chair of the COF and secretary of the COD and on numerous AACP committees. She's received teaching / student recognition awards from UB, UF, and UH. Her scholarly interests focus on curricular assessment, student learning, and the biochemical toxicological interactions of compounds and diseases with skeletal muscle. She's a co-author on over 65 peer-reviewed papers, chapters, and books. She's a graduate of the Academic Leadership Fellows Program and the Community Health Foundation, Western Central New York Fellows Action Network. She was the first recipient of the Maine Pharmacy Association Douglas H.K. Distinguished Educator in 2017 and was recognized as a Maine's Nexters in 2013. She served on the boards of the Maine Cancer Foundation, Scarborough Economic Development Corporation, and Hospice of Southern Maine. She currently serves on the boards for Hospice of Huntington and the American Federation for the Blind, and as a secretary for the Fairfield Community Development Corporation. She and Daniel have been married for over 40 years and live with their dogs, Morgan and Mendel. So thank you, Dr. Brazeau, for your wonderful background, and thank you for sharing with us, and thank you for being here. And I'm going to turn it over to you. Thank you.
Well, thank you. And I am delighted to be able to do with you virtually. As Elizabeth said, I wish we want to have you see us here in person. So today I want to take a few minutes to talk about the School of Pharmacy, if you're familiar. On the call with us is Megan Russell. She helps me with our outreach, and she's really instrumental. Megan can also answer questions about the school. I've been here 2 years, and it's been a joy to be part of the Marshall family and the School of Pharmacy family. So we want to talk a little bit about our school, and then I have some still pictures of the building. We also have a video that's about 11 minutes, but I wanted to talk a little bit about School of Pharmacy. And I don't mind being interrupted, and we'll go ahead. So let's talk about it. We at School of Pharmacy say we are family. We are a School of Pharmacy family, and you are all part now of our family. So we're happy to have you here. So this is our Stephen J. Kopp Hall here. Our beautiful, this was a picture that was taken recently to show our building. It was kind of ironic. We moved in our building in August and celebrated its dedication in September. And then about 6 months later, we were all out of the building, with the exception of the few of us. It's a corner of Hal Greer and Charleston Avenue, and we're really delighted to have this be our new and our home in the Marshall University Health Science Center. This was our last white coat ceremony for our class of 2023. This was actually held at Foundation Hall. We're not sure how we're going to do that this year at all, but we are hoping to welcome about 65 plus students to the School of Pharmacy in the fall. We like to target around 70. It's been a challenge, and our admissions committee and people like Megan Russell and Brittany Thompson have been great. These are students from the tri-state area as well as students from across the country. And so we're looking forward to welcoming our class of 2024. I want to talk a little bit about what is a Doctor of Pharmacy degree, maybe give you some history. I'm sure many of you have been in Huntington have heard about the school, who we are, what makes our program unique, give you some highlights of our building, and then talk a little bit about pharmacists. And then finally, how can we help you? What can we do? Pharmacists and our school are help to reach out to you and your communities here. So I want to share some of that. The Doctor of Pharmacy degree is an entry-level degree for the practice of pharmacy. It's a 4-year professional doctoral degree. You can think of it as a dental, similar to a dental degree, a physician. And we have now an early assurance program at Marshall for their freshmen and sophomore. They then can matriculate into the program, but we will take students that have 3 years, a bachelor's degree, and even advanced degrees. We target about 70. Most pharmacy programs, we have our classrooms, and you're unique. You're going to see our studio classrooms. We have laboratories. We have practice experiences, our introductory and our advanced. And we focus on a lot more, and continuing being now in the Health Science Center with interprofessional education to work with our colleagues across the country. Many of you, I think Kevin is a person that's truly given to this community. Originally, we were out at the Hershey Woody Williams VA Medical Center, and we were there for the school for our first 5 years. We feel very fortunate. Very few pharmacies are blessed to have 2 beautiful homes. And that building was dedicated in 2012. Our first class entered in 2012, and then we had our first graduating class 2016. So 2020 would have been it's an exciting time for us as we graduate our 5th graduating class. We are fully accredited, so we are excited about our progress. We have a tremendous group of faculty and staff that really give their heart and soul to the school and to our students. Again, we're fully accredited by our accrediting body. Dean Gallagher was our next dean, and he was essential in getting full accreditation status for the school until the 4-year accreditation standards, which is the normal process for schools that are new schools, till 2022. And so then we are now starting to work with the next cycle, which will be an 8-year cycle. This is our mission. We want to advance patient care, developing innovative practitioners, research. We want to have research in West Virginia as well as tri-state. We are very proud, and Megan runs our social media. We have a number of our pharmacy students and pharmacists are frontline in their community pharmacies and their hospital pharmacies, and they're really working as we try to help our element. We really have a passion of reaching out to the Fairfield community, to Huntington, the tri-state area, and working with our various partners and community and institutional pharmacy. Our vision is we're Marshall, we're leaders in innovation, education, practice, and research, and we like to believe that we are the future of pharmacy education. When you see how we talk about interact with our students, we are novel in how it sees. And we're going to quickly go through these. These are our real culture here. This is what we try to, these are related to our core values. They are our core values. So we want to maintain a culture of compassion, congeniality, collaboration, commitment. We want to maintain a culture that's committed to being innovative, creatively, and competitive. We want to make sure that we're always looking forward and trying to be competitive, but use that from a motivation perspective. We expect that we will work daily to achieve competence in each of us, our students' character, commitment to the community where we serve. And we want to work towards improving care for those we serve through cost-effective care, evolution, and improvement of pharmacy practice. You know, your community pharmacists and hospital pharmacists can provide a lot of great service to you as a individual, as a person, and they're out there. Pharmacists are there currently on the front line, really making sure that everyone can get their right medicines and use their medicines safe and effectively. What makes us unique? Well, I like to tell, and Megan will probably agree with me, I tell students when they interview here, it is not that we are, we don't lecture at them, we learn with them. So active learning is our focus. You're not going to find the big classrooms with stadium seating, you're going to find studio learning centers where students learn in small groups. We want them early on to do a lot of simulation. They get a chance to be a lot of hands-on laboratories from the first day they come in, so that when they go on to their rotations as pharmacists, they've had it. We are committed to being affordable and allowing access. We have committed to keeping our tuition around the $20,000 compared to other schools. That's very reasonable. That's in-state, a little bit more out-of-state. But if you look at current pharmacy schools, a lot of private schools tuition are on, and even state schools are on the order of $30,000, $40,000 and $50,000. And because of the tri-state area, we want to be committed to allow access to be affordable. And we're working very hard to have scholarships. We are also passionate about serving the many first generation students and second career students who are now part of our program. For some families, this is the first professional that they've graduated, and we love to share in that. We want to make sure there is a lot of jobs for pharmacists in West Virginia, particularly in some of the rural areas, and we want to make sure that pharmacists can help in providing that care to many of the rural communities. And we believe Marshall is that kind of university, given our passion to be a family, for us to be a family, and to be able to give back. I think we're a perfect fit. What is active learning? Well, if I were with you, I would give you a note card. And I would ask you, what do you believe is involved with active learning? So if you had a note card, I would hand you a note card. I'd say, okay, I want you to write down what you think is active learning. And then what we would do is I'd say, after you've done it down, I would say, okay, I want you to share what you think is active learning with the person next door or the person sitting next to you. And you two would talk about what you think both think of active learning. Then we would say as another active learning, then you would maybe your table would share, and then maybe you'd share it with the table next to you. So we're not lecturing at you, we're learning with you, so you can sort of embrace what are these learning concepts, because it's an adage that we have, if you give a man a fish, you feed him for a day, but if you teach him how to fish, you feed him for a lifetime. And we are really focused upon giving our students the skills, because as I tell them when they come, we'll only be with us for 4 years, but they have a 50+ year career. And the most important thing they can learn from Marshall is how to learn from the School of Pharmacy. You know, when I graduated pharmacy school in 1980s, and I like to tease my students, when dinosaurs roamed, we were just starting to talk about these amazing drugs called prostaglandins, or compounds, prostaglandins and leukotrienes. We had no idea about these antibodies and all these things that were, you know, these monoclonals. So, and we had no concept that pharmacogenomics and genetics would play a role. So we want them to learn how to learn. So that's the active learning. We also focus on the flipped classroom. And again, I would ask you to say, what do you think is a flipped classroom? I would have you write it on a card. I'd have you share the characteristics. I don't know if anyone wants to maybe take a few minutes to talk about what they think the flipped classroom is. I don't know, Elizabeth, if that's an option for people to maybe say what they think the flipped classroom might be. I don't know if I can hear her. I don't know if we can, I don't know if I can mute or do that, or.
I said, Eric, can I mute everyone and we can answer that question if you would like.
I think it'd be good if people would like to think, what do you think is the flipped classroom?
They have to unmute individually.
Okay, everyone, you need to unmute individually, and if you can answer the question from Dr. Brazeau. I'll start with, I have no idea.
Well, please call me Gail, please, because we're all part of the Marshall family. So.
Okay, Gail. All right, thank you.
This is Rick Walker. My basic understanding is that students would get a lecture in class and do their homework at home, but a flipped classroom is where they present the material to themselves at home via a podcast or something reading, and then they come in and do their homework together and ask the questions as they encounter the problems. But that may be a very basic and not a complete understanding of flipped.
Well, I think, Rick, you're going to be able to teach for us in the fall because you nailed it. I think this is what it is.
I was laid off this fall because of COVID. I was a surgeon for 40 years, and now I've been teaching at Marshall for 7 years, and now hopefully we'll get back in the spring.
But, you know, so you are right. It really is. We're really kind of turning the classroom on the side. All of us, many of us went to school where we had the, don't get me wrong, the talking head, the professor would talk at you and you'd basically take your notes, and then you'd go home and you'd sort of study those notes, and then you'd come back and take an exam. Here, we're really trying to engage them in the learning process. So a student, and we'll talk a little about that. So I'll move my slide to the next one here. You know, active learning in flipped classroom involves students at participation via their activities. They do some reading and get prepared for it. It's not passively listening to the professor lecture. It's collaborative. It's about having face-to-face discussion. It's made for a new generation of students. These students that we have, they're much more visual, they're much more hands-on, they're much more social, they're much more using their technology. In the School of Pharmacy, we provide every student with an iPad. This iPad will enable them to be able to listen to class, look at their lecture notes prior to it, look at any materials, do reading, and when they come in, they have access. It also allows us to have a standard platform for testing exams, so it makes it easy. We do provide that as part of the students' fees. So here's a good example of this. So well, if you're looking at your left-hand side, it's the lecture, and there's a talking head and students listening, and then they go home and do their activities. But the flipped classroom, they may be asked to look at a lecture or be able to read some materials. When they come into the class, that's the pre-work. When they come in, they may be asked to do an individual readiness assessment. How much did you take? They may be asked to do a group readiness assessment, so we're kind of knowing where they're at. Then we have some type of class activity that they will engage. So they might be asked to identify some series of questions that you might want to ask the patient. They might be asked to outline what are some organization of these chemical reactions and how that might be related. That really is a flipped classroom. So you're really taking the classroom time to be able to focus on learning. I mean, most of us that grew up in the traditional classroom, you learned on your own. Here you're learning in a group. Here you're learning for the expertise of others that are in your group. It also is advantageous because it provides students with an opportunity to learn how to work in teams. And if we're going to be asking our students to work in interprofessional teams, they also have to know how to work in teams with pharmacists and as well as teams with physicians, nurses, and other individuals. So these are the kind of things, that's a flipped classroom. Can I answer, maybe take a break and let's see if I can answer any questions at this stage here. Okay. Well, we'll move on and we'll take time for, certainly have time. This has been I really enjoy having the opportunity to share our school with us. We're just so excited about this. What's other unique about our pharmacy school, and you'll see it as you go through our building, we really have beautiful state-of-the-art simulation areas. Again, when you see our laboratory, you might be familiar with chemistry labs or biology labs where everyone sort of had their own individual seat and maybe their chemicals. We tend to work in a environment that is kind of, again, working in a team environment. So our students get a lot of practical and daily pharmacy activities before jumping into their introductory pharmacy practice experience, which they do their first 3 years, and their advanced pharmacy practice experience, which they do in their last year. We make sure that all our students have certifications at no cost. They all get certified to become an immunizer, and if you know, many pharmacists are involved with immunizations right now for pneumonia, for flu, and as we expect, as COVID comes 19, I'm sure that community pharmacists will also be playing a role for vaccination for COVID-19. They also work with medication therapy management to help patients be able to manage their medications. And pharmacists look at a partnership of working with their patients. They do diabetes management, so helping folks. So each of these certificates, we have a number of interprofessional activities with medicine and other health professions. And Marshall University made sense to have a school pharmacy, given that we had a school of medicine. We had a school of health professions with nursing and PT and OT, and now as we develop a physician assistant programs. And we're also unique in that when our students come in and do their introductory pharmacy practice experiences, they do it across 3 states. They do it in West Virginia, Kentucky, and Ohio. So they have intern license. So they're seeing how practice may differ from the various sites here. So that's, I think, what makes us somewhat unique. So that's kind of an overview of the school, and how we can do this is now I want to take a few minutes to show you some still pictures, and then hopefully we can go through the video that one of our students did, Jessica Mays, did for us. But let me kind of talk a little bit about the building. This is our virtual tour, and I will be happy to share these slides with them afterwards if they'd like. Elizabeth, I'm happy to provide the slide. So again, here's our building. This was the plaque that is on our building, and this plaque, I don't know if I can show you, plaque is on the Charleston side. It's by, I don't know if you can see that, but the door here, and here's a plaque that honors Dr. Kopp and his legacy. And he was instrumental in making this school. He had his vision of having a school of pharmacy that was part of this evolving health science center. You can visit our virtual tour anytime on our Facebook page. We have a lot of other videos about our students that we've done over the years. So this is our current, this is the plaque for Dr. Kopp. Again, I'd love someday to be able to have you see this building. The first floor of this building, where you see a lot, that's where mostly our studio classrooms are. And if you look off to the left, you kind of see an open area. This is a lobby area for students to meet. The first floor is primarily student services. Our two large studio classrooms and our other studio classroom that can be divided into two smaller classrooms. The second floor of that is a beautiful atrium overlooking down the, kind of a second floor overlooking the atrium. This is where our practice laboratory is. I'll show you a picture of that, as well as we have a conference room for pharmacy practice, and most of our faculty members in the Department of Pharmacy Practice live on that second floor. The third floor is our research laboratories. They tend to be at the back towards where you see the brick material. We have a full research laboratory. Currently, our faculty members in our pharmaceutical sciences all have funding and doing a lot of great research, as well as our clinicians in pharmacy practice are working at, we have clinicians at St. Mary's, at Cabell, the VA, so they're all over. So that's our building. Our third floor will then also house the dean's office, the dean's conference room, and then the very top you might see kind of on the left-hand side, you'll see like a little patio. We have a beautiful patio that overlooks Hal Greer, and I'll show you a picture of that. All right. So let me just give you a couple pictures of the building here. So here again is our first floor. This is our atrium here. We have an atrium here that allows for students to study. It is my hope someday in the future, perhaps I'll put a little coffee shop. I don't have the whole atrium there because I couldn't quite in the picture. You can see we have some really interesting lights at the top. I love our little green Google chairs. They're really comfortable. It's a place where you can sit. They swivel so you can talk with somebody, but at the same time, it's comfortable for you to use a computer. And you can kind of work in there. I call these the Google chairs. It's probably what they aren't their name, but that's what I call them. This again is our first floor. Up to the left-hand side near highlights, that would be an example of one of our larger studio classrooms. They're designed such that 6 students can work around those tables. There are enough plugs for each of them to utilize their iPads and plug those in. Along the edge of the room, you can see at the back are our screens where faculty can project. Over towards the left-hand side, and I'll show on the other side, they're actually whiteboards so that groups can work with whiteboards, and if they have an activity where they're trying to draw, they can do that. So we have 2 of these large studio classrooms which can accommodate up to 80. Now with COVID-19, it gives us some flexibility, but we're gonna have to figure out how we can get the social distancing. If you look at the back of the picture at the upper left-hand side, that's actually facing Hal Greer. And that's where you'll have, you might drive by our building, and thanks to our faculty and staff, we have a series of little posters that thank our frontline workers here. But that is actually facing Hal Greer. To the bottom right-hand side, that other picture is our small studio classrooms. This is actually, if the wall is there, this back here to the right is a wall that you can open that up, and it can be, again, accommodate up to 80 people. We again have the screens. You can see one has a Marshall logo, and then again, there's whiteboards around it where students, again, each of the tables have a plug in the middle where students can plug in their iPads. And again, they're assigned to work in groups of 6. So again, bringing team, and they have a group that they work throughout the semester. They switch the tables, but you basically have those all around. So that's the first floor of the building. We have, in addition on that, our student lounge area here, and off to the left of that is some microwaves, some refrigerators. We have 2 small study classrooms. So there's a lot of places for students to meet and gather. This is all pre-COVID-19, so they could study in groups here. With COVID-19, we're having to do some rethinking, but when we have our vaccine and when we're doing, we look forward to having them coming back. We want to make sure that they feel like they have a home, a place that they can come and work there and study there and feel like they're comfortable here, and that this is their home, and we've tried to make it very comfortable there. Our second floor this is our teaching laboratory. Now we're in the process of, normally there's chairs around this here because again, students will work in groups. If they're going to be doing some type of experiment, there may be some individual components and some large components. These back things at the back, those 4 blue things are actually windows. They're overlooking our back parking lot. And over here, if you look to the right hand of that picture, you kind of see what might be some shelves. That actually leads to a sterile product simulation where they can learn how to do IVs. Again, we focus on working in teams. We focus on having, and this is much different than the laboratories you would have seen in maybe in your chemistry or biology courses with the big tables and individuals. We try to focus on working individually here. I would say one of the things I'm most proud of is our 10 skills alcoves that we have on our second floor. Each of these skills alcoves could accommodate up to 4 students to study. Each of them have a camera. So if we had a student and we had a simulated patient, and we're always looking for patients that want to be simulated patients. If you're interested, give us a call. We're always looking for people that we train through the School of Medicine to become patients that work with our students. They would meet with them. These can also be studies. Each of these projection screens that you see, each one has one of those that students can actually connect their computers or iPads. So if they want to work in a group, they can do it. We've got some carts over here, and we have 10 of these that are scattered on our second floor of the building here. Great teaching link. Again, there's some boards for them to write on. And so this is another way of focusing on learning in teams, learning together. And these skill codes are really nice. And again, also allows us to do some individual student assessment with respect to simulated patients and other elements here. So that's our 10 skills alcoves here. On that second floor is all our pharmacy practice offices here. There along the outside, there are conference rooms for our practice. And there's small also conference rooms for folks to meet. Now with COVID-19, I'm not sure how much we're going to be able to use those. On the third floor, we have the Dean's conference room and our patio. And I'm saying that that patio is up on the top. We've got some great chairs up there. It's a little warm there right now in the summer to sit out there, but in the morning and in the afternoon, it's quite delightful. Again, the Dean's conference room has video projection here. Those are the steps. And again, those where you see the white shades, that's facing Hal Greer, and that's outside those white shades is where this space is at. You know, we've been able to take this also, and I don't know if you didn't get a chance to see, but during Black History Month, we did honor Black History Month with a big banner. We also very shortly had a banner honoring all the Marshall graduates, but unfortunately a windstorm came and ripped it off, so we'll have to get that repaired. But this is our third floor and our Dean's conference room. And beyond this, there's a Dean's office here. And I'm on basically on, if you see that little white in the Dean's office, kind of see that glass that's kind of clear, that's where my office is kind of hanging out there. And then these are our research labs. The whole back of the building is our research labs for our pharmacy practice. For our pharmaceutical sciences. There are probably 6 different alcoves that can go there. We also have a sterile products facility. We have a walk-in refrigerator. We have a microscope room. We have a room for our mass spec. We have a room for our NMR. And so we're very proud. Off to the right is a huge refrigerator bank. So we have recently started a master's program, a master's in pharmaceutical sciences for folks that want to be able to be to either go on and pursue a PhD or want to work in the pharmaceutical industry, starting at a master's degree. So we do have a new program. We are always looking for new students. This is also an opportunity for students that perhaps maybe have finished with a chemistry or biology degree and say, well, what am I going to do with that now? And this is a pharmaceutical science has a lot of opportunities. The industry is not going to go away. We think that we can form a gap, help to fill a gap for folks that have good science backgrounds here, as well as those that might want to go on to pursue a PhD at this stage. So that's really our kind of an overview of our building. The last bit, I'll kind of just talk about pharmacists, and I'm sure you're aware of all of those, and then we can go back and we can show the video here. Pharmacists wear many white coats and many hats. They're accessible, they're friendly, they're good at the bedside, they're good at the counter sides. They continue to be one of the most highly educated healthcare professionals, and they're consistently ranked in the top 10. And we're seeing that more because your community pharmacist has been there throughout COVID-19. They're trying to answer your questions. They are there, they're passionate about making sure that you're successful. If you think about pharmacists, the average time it takes to take a doctor of pharmacy degree is 6 years. That's those 2 years pre-pharmacy and then the 4-year professional pharmacy. Again, if people want to get their bachelor's degree, we certainly welcome them. If they want to come after 3 years, they basically have to have a core courses of biology, chemistry, organic, statistics, biology, and Megan's online, so she can talk a little bit about that, and we would welcome. We still can do individual tours if people want to come see our building here. You have some young men or women that want to come and see it, we're happy. Pharmacists, when they graduate, can become advanced in specialty areas like cardiology, geriatrics, oncology. And so they may do what we call a postgraduate 1-year residency and then maybe a postgraduate 2-year. We also have those in community pharmacy. So pharmacists can be specialists, and we have a number of them in the school that help us teach cardiology, infectious disease. One of our current faculty members is the COVID pharmacist over at St. Mary's. The nice thing about it is that 90% of Americans live within 2 miles of a pharmacy and a pharmacist. So they're there, they're accessible. They're committed to you to help you not only understand your prescription medicines, but your over-the-counter and your supplements. We are here to answer the questions. We're here to help you be successful here. About 45% of pharmacists work in community pharmacies, 55% of pharmacists work in hospitals, pharmaceutical industry, clinics, nursing home, a very fast growing area for pharmacists. There are pharmacists working in areas like palliative care, long-term care, helping pharmacists helping people to manage their medications. My vision for pharmacy is that you'll have pharmacists in the road. That future could be your concierge pharmacist, someone that you could work with one-on-one to help you understand how you use your medicine, so that when you go to talk to your physician or you go to talk to your pharmacist, you're more informed, and that forms part of a whole team, a network. So I think I'm very excited about pharmacy. I've been excited about pharmacy since I decided to be a pharmacist in 7th grade, and I still convinced that pharmacy has a great opportunity for people that have that passion that want to help. And this is what they help people do: medication advice, filling prescriptions, vaccination, consultation, opiate. They're involved with all different types of activities. We're seeing more pharmacists involved now with pharmacogenetic counseling, making sure that that drugs don't interact. They are here to help you. And so with this, pharmacists are here. They want to be a passionate partner, helping you to manage your medications, work with other members of the healthcare team. We're excited when we can partner with our folks in clinics and in hospitals and everything else. One thing school pharmacy is also trying to start up now is try to have a resource for physicians and pharmacists where drugs may be in shortage. So here's some options if this drug isn't available. So pharmacists are here for healthier lives here. And so, we're here to ask how we can help you. We can help you to make sure you get that vaccination. We can provide one-on-one consultation. We can answer your question. We would be happy to come back post-COVID to do brown bags to talk about your medicines. We can do all types of specialized programs and much, much, much more. We are here to be part of your community. We're here to help you be able to use your medicines here sufficiently. And we are delighted to be a part of the Huntington community and the tri-state area here. It's exciting, when we know that we now the pharmacist across the street from school pharmacy is one of our graduates. We know another of our graduates at the CVS. We know that our graduates are working at the local hospitals, working at hospitals in Portsmouth. So we're just delighted to have so many graduates in the area. We also need some of our graduates to go to rural areas. You know, we've recently, we wrote an article about our concerns about pharmacy deserts, and we want to make sure that we can attract students from rural areas, come here and get their pharmacy degree, and then enable them to go back and serve the community that supported them as they grew up. So we're very excited about that. We have Facebook, social media here. We have a Twitter at MarshallPharmD. We try to get all our elements here. We're just very excited about that. And then, you know, this Megan is on the call. She helps with director recruitment. And we are, you know, one of our challenges right now is we want to make sure that this continue to be affordable for our students, so we can, you know, have scholarships that can help cut the cost of tuition. Because again, for many first generation students that haven't had someone go to college, sometimes it looks a little scary, but the more that we can help them support their cost, we want to do it. So we're delighted to be able to have this opportunity to visit with you. I guess, Eric, the best way for me to would go back to the slides and see if I can get the video to work, or how would be the best way to do that? Or should I stop sharing and you can share the video here? Or?
Eric, are you there?
I am. Sorry, I was doing something else.
What would be the best way for me to go back and see if I can pull the video from the PowerPoint here? Or
If you're done sharing, I'll share mine and we can.
I'll stop sharing, okay? We'll stop sharing, okay. All right, okay, so I know how to, maybe you can help, sure I know how to do that. It's delightful to see all your faces. All right.
Everybody see it?
I'm a second-year student here at Marshall University School of Pharmacy. Today we're going to be doing a virtual tour here at Stephen J. Hall, home of the School of Pharmacy. So thanks so much for joining us. All right, guys, so we're going to go ahead and head in.
He's on the third floor now.
So this is the third floor of the School of Pharmacy. So this is the Department of Pharmacy Research and Science. So this is the main entrance to the third floor. So to our left here, we have one of our many conference rooms. There is a conference room on each floor of the School of Pharmacy. We have study spaces here for students in between classes. We have one of our artifact cabinets. So a lot of connections with the School of Pharmacy over the years have donated. Here to my right is another study space for students. As you'll notice, there are 3 TV screens. There are 3 TV screens on each floor. So on our main TV screen to the left, we have what's called our brag board. So if we have a professor or a student that gets published, that will be put on the brag board. We have our center screen that will be for Marshall news, so anything that's going locally within Huntington. And then the far screen here is usually what we use for global news. So no matter where you come from, the School of Pharmacy will keep you updated on news. To my right, here's the Dean's Suite. So Dr. Brazeau, our Dean of School of Pharmacy, this is where her office is located. The other associate and assistant deans are also within this suite, and all the administrative faculty for the School of Pharmacy. As you walk down the hall here, we do have all of our classes that have graduated so far. Here in 2020, we're about to graduate our 5th class. So they will also be put on this wall as well. To our left, we have all the research labs within the School of Pharmacy. The research labs are bench research labs, so each professor has their own bench, and any student that is interested in doing research with faculty will also be up here as well. The research labs are broken into 2 main sections. So we have biology on the left-hand side, and we have more chemistry on the right-hand side. So as we get down to here, this is more medicinal chemistry for the school. rooms. The wellness room is really just used for students who may come into school, they may not feel well, and they just want to take a seat, maybe sit in the dark, maybe they have a migraine. This is also used for students who maybe in the past have given birth recently, and we've had students who have wanted the need for just a private room that they can use for themselves. This is the analytics lab. So this is where I'll personally be doing research later on. Inside we have various pharmaceutical equipment such as a dissolution machine. We also have an old-fashioned tablet press that was donated by our own Dr. Cynthia Jones. So this is again just one of the various labs that we use in the School of Pharmacy. Guys, we're now on the second floor of the School of Pharmacy. So this is DPPAR, so Department of Pharmacy Administration Research. So on this floor we have student lockers available for students who do want them. There are more students than lockers, but most of our students live locally, so there's not a need for all students to have a locker. So as we move down the hallway, these are our skill alcoves. So the alcoves are where students at the School of Pharmacy will do their patient simulations. We are able to record any simulation that a student does, and that serves purposes both ways. So in that instance, a professor can critique a student on something they need to improve upon, or if a professor maybe misses something that the student does, the student can point that out to the professor as well. When we're not using the alcoves for patient simulations, they're used as just individual study spaces. There's enough for about maybe 4 to 6 students that they want to study in a group. And all the TVs are AirPlay capable. So within the School of Pharmacy, our students do have iPads available to them. They can put their PowerPoint slides, any work they do on the TV screen. And if for whatever reason they're not using their iPads, all the TVs have HDMI inputs and outputs, so they can also just connect their computers to. All right, guys, so as we move on down this hallway here, to my right is the demonstration lab. So in the first year of the School of Pharmacy, you learn compounding lab. And as you move up, you will learn to use different sorts of like pharmaceutical equipment. And on the right-hand side is actually what we use for sterile compounding. So we do have IV hoods available. They are kind of set up the same way as they would be in a hospital. So students are able to compound various IV bags or any other sort of substance that would require sterilization. Alright guys, so as we move on from the lab, the sign you see here is actually from the original School of Pharmacy that we got from the VA Medical Center. So all those who attended that first kind of like inauguration of the building or naming of the building, that was all from them. As we move on down the hall here, to the right, we have all of our faculty offices and faculty lounge. So this is mostly where all the pharmacy professors' offices are located. So all the pharmacists that work within the School of Pharmacy. As we move on down here, we have more study spaces for students. The same 3 television screens you saw on the 3rd floor. And again, we have the conference center for the 2nd floor as well. Most of the use of the conference center for on the 2nd floor is usually for like student orgs or smaller meetings. As we move further along, this is one of the other artifact cabinets. So a lot of this was donated or brought in by connections to the School of Pharmacy. We have an old-fashioned torsion balance, old-fashioned inhalers, a original like West Virginia pharmacy license. And this is also where the balcony to the 2nd floor looks over. We have our nice little hanging lights here. They kind of look like they're floating at nighttime, so it's really pretty in the nighttime. And just look over to the lobby. All right, guys, so we're now on the 1st floor. So this is the main entrance to the School of Pharmacy. So this is our lobby here. So as you see, there's different tables and setups. Most of the students within the School of Pharmacy choose kind of just a relaxing space for them. We usually have the news playing. We also have our various little like Art Deco chairs. We also have our main screen here when you come in. It's fully touch screen. It has the full directory. It'll actually tell students how to find their professors and walk them through. So for example, if you have Dr. Akbar as your advisor, the screen will actually show you how to get up to his office. So it's a really neat addition. So a very interactive map for students.
Interactive.
As we move on down, we have more study spaces for students. All the outlets and USB inputs and outputs are built within the couches themselves. So students to kind of like scramble to get an outlet to plug in their laptop. And as we move down further on the first floor, we have student affairs on our right. So if you have any need for student affairs, such as admissions or progressions, that's where you'll find those faculty. So on the first floor as well is our student lounge. This is on my right here. So within the student lounge, we have 2 Keurigs, 2 microwaves, we have a toaster, full functioning fridge. There's plenty of space for students to sit down to eat their lunch. Also in the back of the student lounge, we have 2 additional study rooms. Those can usually come placed at about 4 to 6 as well. And they have the same television screens as you saw upstairs that you can use for AirPlay or to plug in your laptop. Each class that is admitted into the School of Pharmacy, we have them sign the Oath of the Pharmacist. So the Oath of the Pharmacist is just a pharmacist, how they plan or what they're dedicating themselves to within their profession. So as you see here, class of 2020, 21, 22, so on and so forth. So we have a white coat ceremony before students are admitted to the School of Pharmacy, or they come into the School of Pharmacy, and they actually sign that at their white coat ceremony and take the oath at their white coat ceremony as well. So in here is one of our classrooms. So this classroom is the P2 classroom. On the opposite side of this wall, we have the P1 and P3 classroom. The reason the P2s have their own classroom is their classes are within the middle of the day, so we're not able to share with another class. And the P1s and P3s are kind of offset from each other, that's why they can. So as you see, there are whiteboards around the entire perimeter of the room. We have multiple tables. We have the student pharmacists have their own groups within their class, so they usually sit 6 to a table. And that's just to accommodate them that way. We have all the television screens around the perimeter as well. So the professor up front, if they're using like their PowerPoint slides, anything of that nature, it projects to all the screens. That way all the students have full access to that as well. All right, so on my left here, this is the P1, P3 classroom, which I mentioned earlier. On my right, this is one of the split classrooms. The split classrooms are usually used for student organizations or maybe smaller electives that students take within their P3 year. We do offer multiple electives here at the School of Pharmacy. We have things like critical care, or we have residency prep courses for students who plan to do residency. As we move further down here, we have more study spaces for students. The other half of our split classrooms and 2 more television screens that students can use to study for as well. What you may see here is just a storage closet, but the storage closet is actually whiteboard, so students can use the whiteboard as well. And the partition that is put down the split classroom is a whiteboard as well, so students have multiple surfaces that they can write on if they're studying, and that's just to accommodate many students or their study styles.
Well, I want to thank Justin for providing that tour. We utilize it as we've been doing virtual tours. I'd be delighted to be able to answer any questions now about the school. I know that Megan is on the call with me, and more importantly, we would love to have you here in person. So we know there's going to be a post-COVID-19, and we know that we want to have you, and we welcome you as a part of our Marshall School of Pharmacy family.
Dr. or Gail, I have a question. Am I correct in knowing that the School of Pharmacy made hand sanitizer during the hand sanitizer kind of event that when we couldn't find sanitizer?
Yes, we Dr. Robert Stan, in conjunction with Dr. Tiffany Davis and Dr. Kim Brodolzak, got us a emergency license from the state of West Virginia to be a sort of pseudo pharmacy to compound hand sanitizer. We provided this for various nonprofits. We provided it for, actually for the fire department here in Huntington. It's interesting, we made it with everything from isopropanol alcohol to when we actually made it with 191 proof alcohol that I bought at the liquor store. I couldn't get the other stuff we needed to have, so yes, we did make hand sanitizer. we may have to go back and we might have been, but yes, we did that. We also, we're very proud, we did in May, we did a drive-through food drive. Our parking lot is in the back, so you can actually come in Charleston and go out 11th. And people like Megan helped us, and we actually, we accepted cash. We raised $440 worth of cash, and we collected 538 pounds of food for the Facing Hunger food bank.
That's impressive. So I know the Fairfield community is very near and dear to your heart. And are there any opportunities that we could, as a group or individuals as this group, participate in or help you with from time to time with your community service initiatives?
Well, I know that we are continuing. We know that down the road, Fairfield Community Development Corporation has just recently got their 501c status. So we are going to be thinking about, I'm actually the chair of the fund and fundraising committee. So we are looking at ways to perhaps have friends of Fairfield that could help us, because we want to be able to provide it. We're in the process of looking for an executive director. Sandra Clemens and Sean Hornbuckle have done a great job bringing that group together. We work a lot with the AD Lewis. So on our website of what's going to be going on. And I think it's only a start of a good relationship with Fairfield here. So we may be doing a community campaign, some funding for that, for the process. Yes.
Gail and the group, this is Bill Wilson. I thank you so much for this one beautiful presentation of the building. I'm fortunate that when I retired in 2013, I became a standardized patient at the med school, and then of course began to move over to the School of Pharmacy as a simulated patient, standardized patient. Of course, that I think that you all use the term at the pharmacy school, a simulation patient. But that has been a wonderful experience, and I would encourage any of our group to do that experience. Though I experienced out at the VA at the original site, of course, an entirely different clinical skills room, but these new rooms are just so super. And it's a powerful experience because it is that interaction, and it's been interesting to be the patient and to be helping these students to learn how to relate to real people, and it's been amazing to watch them grow, and just a wonderful group of students that we have each year. So, and the other thing I wanted to affirm was it just blew me away the first time I came into that building, because I'm so interested in history, the artifacts. And I didn't realize they were on all, I guess I hadn't, that they're on all the two floors. I'd seen the one on the second floor particularly, and just that is fascinating, and it's just kind of a nice touch to this modern building and
service. And our students do appreciate, and our simulated patients are so critical because it's different interacting with a faculty member versus a simulated patient, and a simulated patients get a lot of training of how it's a different role here. You get to it's and by the way, for any of you it's a very scripted. I mean, it's a scripted experience. I mean, that's why it's called at the School of Medicine a standardized patient, because everything has to be standardized. And one of my first experiences was with the faculty member being in the room with the student and as a simulated patient, and the person did so well, and I commented to the professor, "Oh, they did so good," and it was something about an injection, and all of a sudden the professor said, "Well, that's okay, but they just got an F." And I said, what? They were so good. They were so good. He pulled up the vial and he said, "They picked the wrong type of vial. It was an adolescent vial for an adult." So, it wasn't real. I mean, it was simulated. With respect to the artifacts, we are always generous to give things. We're looking for new places to put it. We've got some wall space, and we'll continue to do that. And I think it's important for students and for everyone to understand the history, where you come from, and understanding the rich history of pharmacy. We're going for pharmacy where you might think of a pharmacist as just, compounding something or filling a bottle, to these pharmacists that are working with you to help you understand your medications, helping you to understand how you best, and working with like other folks so people know how you can utilize your medicine and family members. So pharmacists are an important part of the healthcare team, and we are here to help you all. And we are just so delighted for all of your support of Marshall. And, you know, personally, I'm just thrilled to be honored to be able to work with people like Megan and be part of this wonderful Marshall family and our School of Pharmacy family. What else can we help answer?
Okay, I'd like to, first I'd like to say it was.
Hi, Diane, how are you?
Hi, good to see you. Good to see everybody. Wish we could see everybody the old way. And someday we will, when we get the right pharmacy solution to the COVID problem. But it was a great show. I really enjoyed seeing the building, and I really want to see it in its real entity when we can. But one of the things I noticed as you talked was that the pharmacy education has become much more complex and scientific over probably the last few decades. And what it brought to mind is that when we've been in Europe and other countries, the pharmacist almost facilitates the kind of work that a physician does. People go to the pharmacy, they don't even go to the doctor if they have a sore throat or what you would call anything that doesn't require critical care. Are we going to be moving in that direction, or have we already moved in that direction?
We have, so first of all, pharmacists realize that we are never going to be a physician and diagnostician. That's not our job. But our job is to help people know how to utilize their medicine. So as we look across the country, different states are different areas. So let's just talk about California. California seems to be a little bit ahead. Their pharmacists have been doing medication therapy management. They have been able to now actually prescribe for some specific conditions. This is all part of the pharmacy law here. And they can bill for those expenses. They can bill for Medicare and Medicaid on that. Now there are some now talking about pharmacists have the potential to, through state legislation, be able to help deal with contraceptives. So California, Oregon, with Washington to be a little further. In West Virginia, we are thrilled because last year, the state of the legislature has finally recognized pharmacists as providers. So potentially they can bill for pharmacy services. They can bill for these consultations. They can bill for this care in conjunction. So it's very varied. The Northeast, where I came from, is a little bit behind the times here. Again, I started when I was at the University of Buffalo. State of New York was the 49th state to allow pharmacists to be immunizers. So many other states, pharmacists, and we're not trying to take away from the physicians, but we're trying to have another source for folks to get their vaccination. When I went to Maine in the Northeast, they were the 50th. Virginia was much earlier in this process, but we are moving towards where pharmacists are listed as providers, can provide these services. I think you'll see more pharmacists and states moving forward to pharmacists working closely with physicians and being able to, we have a lot of collaborative care. There are pharmacists entering in agreements with physicians to help people manage people's blood pressure and diabetes and high cholesterol. We have that over at Cabell. We have that. So you'll find that your pharmacist can do that. And now we have that right. We can do that. It's under our Practice Act here in the state of West Virginia. And Ohio had this about a year ago. So we are moving forward. But here in the School of Pharmacy, we are really passionate about making sure that pharmacists are going to be good members of this interprofessional team.
Thank you.
So tell me a little bit about where the graduates from the first class and the second class have gone into pharmacies or hospitals or pharmaceutical houses, etc.
Well, I can tell you about the few, and I may have to turn this over to Megan because she keeps in touch with many of our alumni. So, for example, I know some of our class of 2016 is now, a couple of them are up at the Walgreens up in having a senior moment, my own senior moment.
Ken.
Uh,
They're in Hurricaneville.
Hurricane, they're up in Hurricane, sorry. Just don't know why I couldn't get that out. And the chief pharmacist here from that group is now working over here at the Walgreens here. Some of our pharmacists are now are doing specialty drugs over in Portsmouth at Southern Ohio Medical Center. I know a number of them have gone on to do residencies and fellowships, are now back here at Cabell. Megan, some other insight?
Yeah, sure. So as Gail mentioned, residencies aren't necessarily required for our students, but we're really starting to see an uptick in students who want to pursue a specific type of pharmacy. And I think in our last class, we had about 15 students who accepted residencies, and that's from everywhere at Marshall Health to places in Florida. We have students at specific like cancer centers in Florida. So it really depends on what their area of focus was. We have a student who is actually at the Indian Health Services Reservation in Montana. So tons of different places. One of the things that we really try to do is encourage students to explore all of the different types of pharmacy. As Gail mentioned, a lot of people come into our program thinking that they want to necessarily work at CVS or Walgreens in the community or retail pharmacy area. But then they find their passion in hospital pharmacy or in industry. So they're kind of stretched out all across the country. And I guess internationally, because we do have some international graduates as well.
We have one of our graduates up in Toronto. We should call them, right there, our alumni. One of our alumni up there in Toronto. Actually, two or three of our alumni are on faculty here. We've hired them back. One is the COVID pharmacist at St. Mary's here. So he's taking care of all the patients over there. So they're out there. We know that some are serving more rural communities here. We like to have students from all over the country come and visit because I think we provide this good sense. I like to tell our students, if you want to come to a school of pharmacy and you're not going to know the dean, then you might not like it here because this dean likes to get out and know their students. One of the things I'm going to miss this much is having the first year students over to the house during orientation. I like to have the alumni come here. So, we're really passionate about making sure they feel like a sense of family. All of our students have a faculty advisor. They also have an academic to get them through it. We really are passionate. I tell them when they come here, I tell them it is not, let me repeat it is not look to the left, look to the right, one of you is going to be here. I said, we're not that. It's look to the left, look to the right. This is going to be your best friend or significant other. Because I have to tell the parents when they come and we meet parents, they say, thanks for giving us your son and daughter for 4 years. We're going to see them a lot more than you, but when they come out at the end of this, they're going to be such a remarkable person, you won't even recognize them. They're going to be that. I don't know, Megan, you can maybe comment. It's just amazing to watch the transformation from a first year student as they mature through our program and become this healthcare professional passionate about helping people manage their medications. It's just an exciting.
Yeah, so I have actually been with the School of Pharmacy for 4 years now. So my first class of P1s are out on their advanced practice rotation. So it's funny to me to see just how much they've grown. But one of the things that I want to mention, Gail said, look to the left, look to the right, this may be your significant other. In the class of 2016, I think that we had 7 or 8 marriages occur between students. So not only can you become a pharmacist, but we're also matchmakers for you if you have somebody who needs to find a significant other.
One of those alumni, last time we checked, was working at Kroger's, and he was moving up through the leadership ranks at CVS. So I mean, they're all doing good things here.
Megan, I should set up shop instead of being a simulated patient.
Yeah, you could be doing the
Hey,
I could be doing the weddings.
Absolutely.
Not looking for work.
Yeah.
Gail, going back to that little humor, when I was a first-year medical student and we were in the gross anatomy lab, 4 of us and a cadaver, and the professor came over and said to us exactly that. Says, one of you will not be here next year. And after everybody sort of was a little bit scared, he said, the cadaver.
Yeah. Yeah, yeah. You know, being in higher education right now is a challenge time right now with COVID-19. I tend to be a more gregarious person, so coming in this building, not having a lot of people is you know, it's kind of hard, but I'm so excited when we do get to touch base. Megan does a great job with our social media. We put a lot of things. She's really been highlighting folks, our students and our faculty and then alumni that have been there on the front line talking about what they're doing for COVID-19. And we've really just been excited. And, you know, we're very blessed. I really feel blessed as a dean because we had such great deans that I got to follow. You know, Kevin Yingling, Brian Gallagher, all these people, as well as the starting faculty, had such a passion for this program. And I think we are, you know, it is a challenge right now, but you know what, as I tell faculty and student staff, when we get out of this, we're going to even be better because we've learned things that we hadn't really thought we'd learned. We want to make sure that Fairfield feels like they can come. I've offered to them, I want them to be a place that they can come. We did offer during Black History Month, we did offer we had a session here in one of our conference rooms and we talked about that. I'm hoping we can do more events like that. You know, as we can open up our building here, and we were hoping this year to do a kind of I think they were for junior high kids to come and understand about pharmacists, and would be focusing on the Fairfield, but also the broader community to get them excited about, you know, potentially looking that this can be your school of pharmacy. You can come back and give back to your community.
We wish for you the best. We wish for you the best, and as this semester starts. Goodness, difficult times.
Yeah, it might be a different semester, but we're going to get through it. Megan's done a great job of recruiting students here. You know, and I think one of the advantages are that we educate differently, but then we're very reasonable in tuition, and we want to limit student debt. So that's why we're focusing to keep our tuition.
With your indulgence, I'd like to share also a first day of medical school story because it does relate to what you said in the very first sentence. When we showed up there on our class at Ohio State University in the fall of 1968, the dean stood up and said, half of what we will teach you in the next 4 years will be untrue. We just don't know which half. And I've tried to emphasize that in my 40-year career in surgery, where there were about 80% of the medicines that I knew and used when I retired hadn't even been invented or thought of. I mean, we just discovered what IgE was. So I think having that philosophy that you have espoused, where we are teaching the professional students to be lifelong learners and to continually relearn is very critical. And I try to keep that philosophy in my classroom as well.
I think it's a good time for all of us to learn at this time. This COVID-19 has been a time for us to be able to think about, and you know, I'm trying to understand some of where I'm going as we think about some of these times of social justice as I'm reading through this and understanding, you know, trying to think through it. But it is about learning, and you know, I use the you know, my college professor said the same thing. 50% of what we teach you is going to be correct when you graduate. The problem is we don't know which 50%. And so I like to instill in our students, hopefully, a sense of what if, excitement, their intellectual curiosity, to have them ask questions. I like to tell them the only dumb question is a question that isn't asked.
Just out of curiosity, have any of the graduates decided to open up their own pharmacies? That used to be a traditional route, but it sounds like it's much more complex today.
I don't know if usually what they will do is they'll buy into a pharmacy that somebody might be selling. I don't know if any of our graduates have done that at this stage here. We are actually seeing a slight uptick in independent community pharmacies because of the service they can do. Again, one of the things I'd like to see the School of Pharmacy do is serve as a convener to understand the important roles of community pharmacies across West Virginia, and allowing places where we don't have these pharmacy deserts. Can we find ways to support those pharmacies? Can we find ways to have potentially a student that might come from one of these rural counties be able to support them, you know, maybe through a scholarship program such that the commitment is they'll go back and work in that community and when they graduate. You know, there's a lot of hospitals that are going to need pharmacists. And, you know, people say, well, there's too many pharmacists, too many pharmacy schools. And there has been a proliferation of pharmacy schools. When I started pharmacy school, there were 75 colleges and school of pharmacy. There's now 144. And at the same time, we've seen an increase in pharmacy schools. We've seen a decrease in the number of students that are interested in pharmacy. Now, I don't know if because we haven't sold the profession for what it is, so it makes it more complicated to get pharmacy. But when I talk to our colleagues that we partner with Walgreens and all these, there are places in West Virginia, they still have openings for pharmacists. They need pharmacists to work in our rural communities here. And so we want to encourage them to try these experiences. When they go out on rotations that are APPE, their advanced pharmacy practice experience, they're not taking any classes. We're trying to send them across to get them a broad array of experiences. And Dr. Rob Stanton and Dr. Craig Kimball do a great job putting our students across various sites, as well as, you know, sites in other states and at the FDA and things like that. So. I see, Jenny, are you asking a question? You might be muted. Jenny, you might be muted.
Here. Now, can you
Okay,
hear me?
there you are, Jen. How are you?
Oh, very good. This has been very informative for the lay person. I must emphasize that. So you've done that very well. But I have a question concerning students who might be leaning more toward research as opposed to being a practicing pharmacist. How difficult is it to acquire grants? Are there many pharmacists graduating who are interested in research versus practicing in a hospital or pharmacy someplace?
Well, I would say at any one semester, any one time, we probably have about 10% of our students are interested in research, and they can work with our faculty members in the laboratory. And then that could be a foundation for them to go on and do it. And that's why I think we have 1 or 2 students that are pharmacy students that are also trying to get their master's. So there's an opportunity. And if you look at some of the publications that our faculty have done, they frequently involve student researchers on it. So in the past, we've been able to support student summer research. We couldn't do it this summer with COVID, but we've provided small research grants for them to be able to do research. And I know that many of our faculty, when they write their grants, like their R03s or R15s, they include money to have graduates, pharmacy students in the research. You know, as I said, I decided I loved pharmacy in 7th grade, but by the time I got to my 2nd year of pharmacy school, I said I knew that I wanted to go on to graduate school or something else. So I think it takes just that one person to tap on someone's shoulder and said, have you ever thought about going into a research career? And the way you do it is you have opportunities for students to work in our laboratories. We actually have students in the laboratories right now, socially distancing and using masks and everything else. And we hope that we can continue to support them. That's one of our strategic plan is one is to be able to continue to find support for our students, to be able to support students in the research lab and to have them travel. So we have provided money for our students to present their posters, to be part of the research. Because it's that one-on-one mentorship with somebody. You know, all of us that went to graduate school had somebody that tapped us on the shoulder and said, have you ever thought about going to graduate school? Or did they do a rest? Somebody gets tapped on, and you only can do that if you have people that you're comfortable with. So we about 10% of our students. I'd like to see more. I'd like to see our master's program grow. We also, I didn't mention, and I should have, we also have 2 joint degree programs in the School of Pharmacy. We have a PharmD MPH, a Master's of Public Health that we work on, and we have a PharmD MBA program. So we have a number of those. I think last year, Megan, we had 7 that graduated from the PharmD MBA program. So they were able to, when they graduated, they had their PharmD, they also had their MBA. So they can look at different career pathways, working perhaps with agencies that provide prescription insurance or decide they might want to go. I'd like to see how we could do some other joint programs. We now have an honors program for students doing research too, that Dr. Michael Havisham has also done. Does that answer your question, Jenny?
Yes, thank you.
I would like to say that I'm so glad to hear of the community involvement of you and your students. The Fairfield group has some big plans and big needs. I think you've been working with the Coalition for the Homeless. I think we got some of your hand sanitizer. I think that your enthusiasm, Dean, has to be very inspiring to your students, and thank you very much.
Well, you know, we are part of this community, and we want the School of Pharmacy as well as Marshall to give back to Fairfield. This is a beautiful community. It has a lot to offer, and I think if we can help individuals find their ways to Marshall and to the health professions, that's going to help all of us. So we're really excited about that, and I'm going to continue to push with us to try to reach out as we can. Again, there's things that we can do given our proximity now to the neighborhood. We're part of the neighborhood. I'm very positive about the changes we'll see in the future with Hal Greer as the Hal Greer corridor changes, as we try to move it in. I think, to me, I've lived at lots of places. I'm excited about being at West Virginia because I do see us on a trend. We are going, there's never been a community that's been more exciting. You know, I have to say, I'll be honest with you, I'm also a big sports fan, so I'm not sure how the fall's going to be because I love college sports and, you know, I'll have to figure out something here, but I'm delighted. I think we're all delighted to be in Huntington, and we're delighted to be at this location. Not that we didn't love being at our friends at the VA, but this is a pretty nice location here.
Do we have any other questions for for Gail?
If I were there, I'd give you all my business cards. I will send these slide deck to Elizabeth, and it has our contact for Megan and I. Again, if you know, this will be a post-COVID. There will be post-COVID. We'll have a vaccine. We'd love to have you here. If you have any family members that want to know more about pharmacy, we're here. You know, pharmacy is not going away. It's going to be an important element. You know,
Oh, absolutely. Your video was wonderful. It is better in person, and we hope to, post-COVID, come and see you in person. I'm thrilled again to hear about everything that you're doing for the community, and we're very, very fortunate to have the School of Pharmacy in Fairfield, so close to campus with all you're doing. And I've enjoyed your presentation, and I got a snippet of it when we met in person, but thank you so much for meeting with us today, Gail. We're very, very appreciative.